Welcome to the session of cardiac arrest in a pregnant woman. Myself, Professor Rajini Gupta, in Department of Anesthesia, Critical Care, KGMU, Lucknow. So today we are going to demonstrate how to perform how to manage the cardiac arrest in hospital in a pregnant lady. So to perform the high quality chest compression in a cardiac arrest situation, and if any pregnant lady become unresponsive coming into the hospital or inside already admitted in the hospital, will become unresponsive. So before start the chest compression, we have to check for the scene is safe. All around the situation is safe, scene is safe, then we will proceed further. We will check the response of the pregnant lady. We will check the response whether lady is responsive or not. For checking the responsiveness, we check Mataji, kya hua? Kya hua? If mother is not responding or the lady is not responding, we will immediately dial the code blue in the hospital. We will press the code blue button, or if it is not available, we will ask our assistant go and bring the AED and amputate. Then immediately after asking that, we will check for the pulse and the respiration. For how long we will check for the pulse and how we will check the pulse. For checking the pulse, we will check the trachea in the midline. Then we will go laterally in a groove between the sternocleidomastoid and the trachea, and we will put our 3 fingers for a 10 second. So how we will check the 10 second? For asking the 1 second, we will say 1/1000. So we will check the 10 second and we will watch for the respiration whether she is breathing or not. So 1/1000, 2/1000, 3/1000, 4/1000, 5/1000, 6/1000, 7/1000, 8/1000, 9/1000, 10/1000. So there is no pulse, no breathing. We will start the chest compression. So before starting the chest compression, we will make say what is the position of the pregnant lady, whether she is lying on the firm hard surface and the position of the ourself, whether reduction or lowering of the bed is required or bringing down the pregnant lady on the floor. So suppose this lady is on the bed and we will check for the bed whether mattress is the hard, firm, or it is soft or not firm. We will just immediately put the hardboard below the pregnant lady. The newer RCOG guideline, for starting the chest compression in the pregnant woman, only manual displacement of the gravid uterus by the assistant is required. The assistant will thus manually gravid uterus towards the left side so that the inferior vena cava will be free for the it will not obstruct for the chest compression. To perform the high quality chest compression, the position of the victim and the position of the rescuer should be adequate. The victim should be on the hard surface and the position of the person who is performing the chest compression, hip should be above. Bring the dominant hand in the front, then another hand, interlock it, and heel of the hand should be over the middle of the sternum. Ideally in a non-pregnant lady, we perform the chest compression over the intermammary line or the lower 1/3 of the sternum. But in a pregnant lady, the gravid uterus lies below the sternum. So to perform the high quality chest compression, we have to put our heel over the middle of the sternum. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 28, 29, 30. After giving the 30 chest compression, we have to give 2 breaths, each breath of 1 second time with chest rise. For giving the breath, we have to close the nose with the help of thumb and the pointing finger and open the mouth and give 2 breaths. So for giving the breath, we can use the pocket mask or give mouth to mouth. After 30 chest compression, give 2 breaths with the help of pocket mask. So how to use this pocket mask? Open it, lid, open. We say this is pocket mask because we can carry it in the purse or with us in a pocket. So we call it pocket mask. Then this pocket mask kept in a box in a already folded situation. So we will take it out from the box and then reposition it. Please reposition. After making reposition, this is pocket mask. Then pointed surface should be over the pointed finger. Should pocket mask is this, that this surface should be on the for the ventilation, so that the whatever secretion, bloody material present inside the mouth of the pregnant lady will not revert back over the thumb and pointing finger like this. 3 finger below the chin and the thumb over the mask. Give 2 breaths, each breath of 1 second time with visual chest rise. Now the second rescuer has come. The first rescuer will continue chest compression. The second rescuer will come with the AED and ambu bag. So he will just take out the AED from the bag. Then what he will does, he will just, first step is to turn it AED box on. So as soon as the AED is on, then AED will start giving the plug-in pad connector next to flash. So what AED is saying, apply pads to patient bare chest, plug-in connection. So we have to apply these 2 pads on the patient bare chest. The first pad from the on the right side below the right interclavicle. Apply pad plug-in connector. So we'll take out this and we will apply this over the right side below the clavicle, and then left pad over the intercostal space. Now the third step to plug-in connection. Now the AED will say analyzing heart rhythm. AED will analyze the rhythm. What? Do not touch the patient. During analysis, we do not have to move the victim. What we have to do, we have to interchange our position in between. So the person who is performing the chest compression will come to the head end and we will move to the chest compression. Now the AED is commanding for the press the shock button. We will press the shock button. Shock delivered. Now same interlock heel. We will start the chest compression and we will continue 30 chest compression. After 30 chest compression, the second person will give the 2 breath with the help of ambu bag. Ventilation with the ambu bag. We have to put this pointed part over the nose and broadened part over the chin. May apply the C and E technique, and you can use the both hand so that the adequate grip is there, and give 2 breaths, each breath of 1 second time with chest rise. This has been demonstrated on the airway session. Airway part has been clear on the airway session. Forming the CPR or resuscitation measure. So we have to continue this chest compression, ventilation, use of the AED till the pulse has appeared to the victim. Meanwhile, if the patient in the ICU or in the SDU, we will prepare for the immediately hysterotomy as soon as possible while trying to resuscitate the victim, because delivery of the fetus is equally important. As soon as the hysterotomy or by the incision baby will come out, the resuscitation of the pregnant woman will become much easier.